Oxygen is one of the most resourceful and powerful agents available in nature. It is essential for breathing and for life processes, but oxygen has numerous other medical and therapeutic uses as well. The therapeutic use of oxygen under pressure is known as hyperbaric oxygen therapy. This type of therapy is best known for the treatment of decompression sickness or the bends, which sometimes occurs in divers who exceed safe limits. In recent years, hyperbaric oxygen therapy has also proven effective in the treatment of diabetic wounds, carbon monoxide poisoning, certain types of infections, and several other conditions. These include air or gas embolisms, gas gangrene, necrotizing soft tissue infections, stroke, thermal burns, skin grafts and flaps, anemia, and osteomyelitis.
The greatest indication for hyperbaric oxygen would be diving-related accidents, namely called the bends or air embolism. But there are other medical conditions which it is very useful to treat, especially a condition called gas gangrene or necrotizing fasciitis, where the organism involved in the infection does not like oxygen. So an environment where there are high concentrations of oxygen, that alone can kill the organism and help the wound to heal.
Hyperbaric oxygen therapy was first used to assist wound healing when it was noted in 1965 that burn victims of a coal mine explosion treated with hyperbaric therapy for their carbon monoxide poisoning healed faster.
Hyperbaric oxygen therapy is extremely effective in healing select diabetic ulcers. Basically, the principle is that using hyperbaric oxygen, we can increase the amount of oxygen available to the tissues around the ulcer and thereby increase the rate of healing.
In wound healing, hypoxia is an insufficient supply of oxygen which prevents the normal healing process. Hyperbaric oxygen therapy provides the oxygen needed to stimulate and support wound healing. Hyperbaric oxygen therapy can be used successfully in hypoxic wounds such as diabetic wounds and venous ulcers.
Well, I regret that if I hadn't had that treatment, I think I'd have lost my left foot. And I would have been a very, very unhappy person without my left foot.
Hyperbaric oxygen therapy is able to combat clinical infections such as gas gangrene by acting directly on anaerobic bacteria and increasing the effects of antibiotics. Hyperbaric oxygen therapy is a safe, non-invasive therapy. The St.Lucia Hyperbaric Society has now made this available to St. Lucia and provides treatment in our hyperbaric chamber housed on the grounds of the Tapia Hospital, adjacent to Bay Medical Center. It has already proven successful in the treatment of diabetic patients with chronic wounds.
With the use of the hyperbaric chamber, the cells can be helped to regenerate themselves through the use of oxygen and to assist the circulation. And that will be a boon to the diabetes facility. And St. Lucians will be pleased to hear about this.
For more information on the treatment options available through hyperbaric therapy, contact your physician or the St. Lucia Hyperbaric Society.